Look at your medication list, the one on your nightstand or in your purse or taped to your refrigerator, the one your doctor went over with you so quickly you barely had time to ask questions. There is a strong chance that one of the medications on that list has a side effect no one mentioned to you. Not because your doctor was careless, but because the research connecting these medications to long-term cognitive decline is newer than most prescribing guidelines, and it is far more alarming than the pharmaceutical industry wants discussed in a standard appointment. I'm Dr. Hayes Anderson, and after 22 years in senior health, I've seen firsthand what happens to the aging brain when the wrong medications are taken for years without anyone connecting the dots. Promise stakes. By the end of this video, you will know which 4 medication classes carry the strongest evidence for accelerating memory loss and dementia in adults over 60, what you need to ask your doctor at your very next appointment, and which safer alternatives exist for most of these. I need to be clear before we begin. Do not stop any medication on your own. What I am giving you today is knowledge, the kind that makes your next doctor conversation far more productive than the one where you left with a new prescription and a lot of unanswered questions. Here is what most people are never told. The brain at 65 is not the brain at 40. It clears drugs more slowly. The blood-brain barrier, the protective filter that keeps harmful substances out of brain tissue, becomes more permeable with age. And the brain's chemical messenger systems, particularly the one that governs memory and attention, become more vulnerable to disruption. A medication that is well tolerated at 45 can begin silently damaging cognitive function at 65, at the same dose, with no warning label updated to reflect that risk. The average senior takes 4 to 5 prescription medications daily. The interaction between those medications and an aging brain is one of the most under-examined problems in modern medicine. Your doctor may have prescribed each one for a legitimate reason. That does not mean the cumulative effect on your memory is being tracked. That is what today is about. Let us start with medication number 4. Number 4. Common sleep aids and antihistamines. If you have ever reached for a Benadryl to help with allergies, or taken a store-bought sleep aid with the word PM in the name, you have encountered this drug class. The active ingredient in most of these products is diphenhydramine, and it is one of the most widely used anticholinergic compounds in the country. Anticholinergic is the term that explains the mechanism. These drugs work by blocking acetylcholine, a neurotransmitter that is central to memory formation, attention, and learning. In a young brain, a single dose of an anticholinergic produces temporary fogginess. In a senior brain, one where acetylcholine levels are already declining naturally, repeated exposure causes something far more serious. A landmark study published in JAMA Internal Medicine followed more than 3,400 seniors over 10 years and found that cumulative anticholinergic drug use was significantly associated with an increased risk of developing dementia. The researchers found that taking an anticholinergic medication daily for 3 years or more was linked to up to a 54% higher dementia risk compared to those who never used them. Let me tell you about Miriam. 73 years old, retired librarian, had been taking a store-brand sleep aid 2 or 3 nights a week for nearly 5 years. She told me she only used it when she really needed it. She did not consider it a real medication. Her prescription drug list never mentioned it because she had never mentioned it, and she was frightened because she had started losing words mid-sentence, not occasionally but regularly, words she had used her entire life. When we identified the diphenhydramine and she discontinued it under supervision, the word finding improved meaningfully within 8 weeks. The damage was not irreversible. but it had been building for 5 years without anyone knowing to look. If you use any over-the-counter sleep aid or allergy product with diphenhydramine, bring it to your next appointment. There are antihistamines and sleep supports that do not carry this risk, and your doctor can help you transition. Number 3, bladder control medications. This is the one that surprises people the most. Medications prescribed for overactive bladder. Brand names that include Detrol, Ditropan, Enablex, and Vesicare are among the most potent anticholinergic drugs prescribed to seniors today. They work by relaxing the bladder muscle, but to do that, they must block the same acetylcholine receptors that govern memory. The dose required to control bladder urgency is high enough that the cognitive side effects are not subtle. They are significant, and they are well documented. Yet these medications are routinely prescribed to seniors without any mention of memory risk. Clifford was 78 years old, a former high school principal, a man who had run a building of 800 students with precision and warmth. He came to my attention after his daughter noticed he had become confused on a regular basis. He was repeating questions. He was forgetting appointments he had written down. He had been diagnosed with mild cognitive impairment at another clinic. What no one had reviewed carefully was that he had been on an overactive bladder medication for 2.5 years. When his neurologist and I collaborated to taper him off the medication and transition him to a newer agent with lower anticholinergic burden, his daughter called me 3 months later and said, and I will never forget this, she said, "Dad is back, not completely." But the man she had been grieving while he was still alive had partially returned. If you or a loved one takes any medication for bladder urgency or overactive bladder, ask your prescribing physician specifically about anticholinergic burden and whether a lower risk alternative is available. The alternatives exist. They simply are not always the first option offered. But now we are getting into the medications that most people would never think to question. Stay with me, because medication number 2 is one of the most commonly prescribed drugs in the country. Number 2, acid reflux and heartburn medications. Proton pump inhibitors, PPIs, are among the most widely prescribed medications on the planet. Brand names include Prilosec, Nexium, Prevacid, and Protonix. Millions of seniors take them daily, often for years, often indefinitely. They are also sold over the counter, which gives the impression that they are entirely harmless. The research says otherwise. PPIs work by dramatically reducing acid production in the stomach. That sounds straightforward. The problem is that stomach acid is essential for the absorption of magnesium, vitamin B12, and certain other nutrients that the brain depends on. Long-term PPI use has been consistently linked in the research literature to significant depletion of both magnesium and B12, 2 nutrients whose deficiency independently produces cognitive symptoms, including memory loss, confusion, and mood disturbances. A study published in JAMA Neurology found that long-term PPI use was associated with a 44% increased risk of dementia compared to those not taking these medications. Paulette, 69, came to me not for cognitive concerns, but for a routine senior wellness review. She had been on a PPI for 6 years, started for acid reflux, and never reassessed. Her B12 level was critically low. Her magnesium was at the floor of the normal range. She had been telling her family she felt like she was living in a fog for the past 18 months. She attributed it to getting older. When we corrected her nutritional deficiencies and worked with her gastroenterologist to reassess her need for long-term acid suppression, her fog began to lift within 10 weeks. She told me at her follow-up that she felt like someone had opened a window in a room that had been closed for years. If you take a PPI daily and have been doing so for more than a year, ask your doctor whether you still need it at the same dose, and whether your B12 and magnesium levels have been checked recently. These are simple blood tests. The information they provide is not simple at all. And now, medication number 1. This is the one I need you to hear most carefully, because it is prescribed most often, questioned least, and carries some of the most serious cognitive consequences of anything on this list. Number 1, benzodiazepines and sleeping pills. Medications like Xanax, Valium, Ativan, Klonopin, and the Z-class sleeping pills, Ambien, Lunesta, Sonata, belong to a class that acts on the brain's GABA receptors, producing sedation and anxiety relief. They are prescribed for anxiety, panic, insomnia, and muscle spasms. They work quickly. They feel effective. And for many seniors, they have become part of the daily routine in a way that was never intended when they were first prescribed. The research on this class and dementia is among the most consistent and concerning in the entire field. A study published in the British Medical Journal followed more than 9,000 seniors and found that benzodiazepine use was associated with an 84% increased risk of Alzheimer's disease. The risk increased with the dose and duration of use. These are not mild signals in the data. These are striking findings, and they have been replicated across multiple large-scale studies in multiple countries. The mechanism is multi-layered. These drugs suppress the deep, slow-wave sleep stages where the brain clears amyloid beta and other toxic proteins, the exact same glymphatic cleaning process we have discussed before. They also appear to directly disrupt the cellular processes involved in memory consolidation. Used occasionally, the risk is lower. Used nightly for years, the brain pays a cumulative price that no one is collecting at the pharmacy counter. Nadine was 66 years old, active, sharp, an avid reader who kept a reading journal. She had been on a low-dose benzodiazepine for anxiety for 4 years. She came to me because she had stopped being able to retain what she read. She would finish a chapter and not remember how it began. For a woman whose reading journal spanned 40 years, this was not a minor complaint. This was the loss of something central to who she was. We worked with her psychiatrist on a very gradual taper over 6 months. This is not something to do quickly or alone, and combined it with cognitive behavioral therapy for her anxiety. At her 1-year follow-up, she had resumed her journal. She described the experience of reading clearly again as one of the most profound recoveries of her life. If you take a benzodiazepine or a sleeping pill from the Z class regularly, please have an honest conversation with your prescribing doctor about long-term risk, tapering options, and non-pharmacological alternatives. This conversation may be difficult. Have it anyway. None of these medications were prescribed to harm you. Every one of them was prescribed to solve a real problem: sleep, anxiety, bladder urgency, acid reflux. The doctors who prescribed them made reasonable decisions. What has changed is the research. What has changed is our understanding of how the aging brain absorbs, processes, and is altered by these compounds over years of use. And that knowledge now belongs to you. You do not have to accept cognitive decline as inevitable. You do not have to leave every doctor's appointment with the same prescriptions and the same lack of conversation about what they are doing to your brain over time. You are allowed to ask. You are allowed to say, I want to review everything I am taking and whether my brain is paying a price I have not been told about. That conversation could be one of the most important ones you ever have. So here is my question for you today, and I want you to answer in the comments. Are you currently taking any of the 4 medication types I described today? You do not need to name the medication. Just tell me. Had you ever been warned about any cognitive risk before watching this video? Your answer matters because it tells me how many people are walking out of appointments without this information. If someone you love is managing memory concerns, or if someone in your life is on multiple medications and no one has ever reviewed the full list with cognitive health in mind, share this video with them. That single conversation it starts could change everything. In the next video, we are going to go deeper into the root process driving so much of what accelerates aging, memory decline, and disease in the body after 60. Chronic inflammation. What it is, what is quietly feeding it in most seniors, and exactly what you can do about it. Do not miss it.